The following demonstration gives an example of how to use the camel. If a resident is seated on the floor and able to, they should be encouraged to bottom shuffle onto the camel. The lift assist can then begin. In the scenario, a person has fallen and been found lying on the floor. The caregiver has established that no injury has been sustained, but the person is unable to get up without help. Ensure the camel badge is in line with the resident's head. The more supine the resident is, the greater the support provided, but for medical reasons, it may be necessary to fully inflate the backrest. The handset is operated by pressing and holding the numbered buttons in sequence, starting with number 1. The backrest should be inflated until the person is comfortable. To stop inflation, release the button at any time. Apart from the backrest, it is essential that all sections are fully inflated before moving to the next. An uneven lift may occur if the resident is not positioned centrally on the camel. This can easily be corrected by placing your hand on the opposite side. For reassurance, eye contact can be maintained throughout the entire lift. Once the required number of sections have been inflated, the caregiver can help the person stand up. If necessary, the resident can rest until they are ready to be assisted to stand up or transfer off. If the resident is able to, and still being supported by the caregiver, they should reposition themselves so as to be seated across one of the corners. It's also possible to transfer off the camel directly to a chair. The resident is seated on the camel with a chair next to them. Once lifted, they are then able to side transfer onto the chair using a transfer board.